penis. Hypospadias as a condition in boys is very common. It is one of the commonest things that is diagnosed in all children. Majority of the children will have mild variety of hypospadias, wherein the urine passage on the penis is opening not on the tip of the penis but on the underside of the penis. Some children will have a more intermediate severity of the hypospadias, where the urinary passage is opening little bit further down, almost up to the level of the scrotum. When it goes to the base of the penis or going on to the scrotum or even further down, then that comes under severe category of hypospadias. Hypospadias is not only about the urinary hole opening, but also about a variety of associated problems. That is, whether there is a bending of the penis towards facing down, or whether there might be a twisting of the penis, whether or not the penis might appear buried. So it might look smaller than what it actually is because it is buried because of the scrotum that is riding on top of the penis. In addition to that, they may have a smaller than normal sized penis. They may have problems with the testis not coming down properly to the scrotum. So all of these various components of hypospadias need to be assessed, and the treatment for the hypospadias needs to be tailored individually for each child. Now, what we are aiming is to create a normal looking penis which has got a normal functional capability. That is, they can have a normal life, be it for sexual function, for marriage, or for fertility potential, and for having children in future life. Again, vast majority of the hypospadias children can father children normally. So there is no problem with fertility potential in the vast majority of hypospadias, more than 90%. Some severe end spectrum of hypospadias may have associated problems with testes and with other problems which may lead to problems with fertility. The second thing to think about is, when do we do the surgery for hypospadias? Ideally, we would like to do the surgery for hypospadias somewhere between 9 months to 2 years. And the reason for that is that the children are very young. They may need 1-stage or 2-stage surgeries. And in those situations, we want to finish all the operations or procedures required for the child before the age of self-awareness and before they have any memory or recollection of the operations that they have undergone in their childhood. When we see children who have had surgeries with us as a young baby, and they don't even remember the operation, and they consider themselves to be completely normal and like all the other friends that they have. And that is very important, so that they have no psychological trauma from the surgery. Also, when children are operated before they go through adolescence, their surgical results are better, because after adolescence, erections that the child has are much stronger and can damage the sutures that we have placed during the surgery and may give us an inferior result as compared to doing the surgery as a young child. Hypospadias is not because of anything that the mother may have eaten or done during her pregnancy, and it's important to feel that reassured that it is not the fault of the mother and it is not because of any other problems that the couple have had. Hypospadias does not run in families on a general basis except for occasional circumstances. Other hypospadia surgery is painful, particularly when we are doing surgeries on the glands of the penis, which is the conical end at the tip of the penis. And for this reason, we always do the surgery with good anesthesia, under full general anesthesia, with added painkiller medicines to be given after the surgery. Generally, the initial severe pain is only for a couple of days, after which the pain reduces significantly. The cosmetic results of the surgery and the swelling that is there in the penis will take easily 1 to 2 months to settle down. If we have to plan and do multiple stages for the operation, usually we would want to leave at least 6 months between operations. The other thing to consider is children can one-stage operation and which children will need multiple stages, planned stages for the operation. Usually a child having a severe bending of the penis during erection may need more than one stage for having an optimum outcome after the surgery. And this is the reason for this is, if we try and compromise and do the surgery in single stage, we may be having a residual bending of the penis, which we do not want, and also which will give a smaller than normal look to the penis if there is a residual bending. So in those situations where the penile bending is there, it is much better to go for a 2-stage operation rather than a planned single-stage operation. For hypospadia surgery with a doctor, with a surgeon who has extensive experience in these kind of operations is very important, because the operation has to be tailor-made for each child. So in that situation, a doctor or a surgeon who has got considerable experience with these procedures can achieve a much better result than other surgeons. Can the foreskin be preserved in children undergoing hypospadia surgery is the next question. In children who have a distal hypospadias or a mild variety of hypospadias, that is, the urinary opening is in the close to the tip of the penis, the foreskin can definitely be preserved and it can be reconstructed to look like a normal penis. In children who have a severe hypospadias, in that situation, then we have to use that skin of the foreskin. That skin itself needs to be used for doing the repair. So in those situations, we have to remove the foreskin and give them a circumcised look. That is, after the foreskin has been removed as a circumcision. So they will have the same kind of appearance as a circumcised boy. Our aim of hypospadia surgery, and that should be the norm for all children who have hypospadias, is they should be having a surgical result which is a normal looking penis. That is, either with a foreskin or without a foreskin as a circumcised look. But it should be aesthetically appealing and look like near normal penis. That is very important in terms of the outcome of hypospadia surgery and for the long-term psychological outcome for the child. And that is our aim with this kind of an operation.